Well, good evening, everyone. We have quite a few people who have joined us for the call this evening, so we're very excited to go ahead and get started. So again, I want to welcome all of you and thank you for joining us tonight. Dr. Gerald Morris and Dr. Amanda Bacchus-Morris will be speaking here just in a few minutes and presenting some information. As a courtesy to the large number of attendees we have tonight, we do ask that you please ensure your microphone and your video are off during our presentation. You will have the ability to send us questions via the chat option, and we will answer as many questions as we can at the end of this call. So first, let's get started with an introduction of the doctors. As many of you know, both doctors are a husband and wife team. They've been serving the Tucson community for almost a decade. They are certified in internal medicine, anti-aging medicine, and obesity medicine. They both were voted Tucson's 2020 top doctors in Tucson Lifestyle magazine. They're also members of several professional organizations, including the American Academy of Anti-Aging Medicine, Arizona Medical Association, Obesity Medicine Association, International Peptide Society, and they also believe strongly in a very personalized approach to treating their patients, which we will hear more about this evening. So without further ado, let me turn it over to Dr. B and Dr. Morris.
Hi, everyone. Good evening. It's a pleasure to have you on the webinar today. I know we're going to do our best to give you as much value and as much information as possible with all the changes that we are proposing and going to be doing as we evolve our practice. My name is Dr. Morris.
And I'm Dr. Bacchus-Morris.
And we're going to start off today just to talk about the changes that we've seen in healthcare in the last 5, maybe 10 years. We've all seen our premiums go up. I mean, for some people, almost double in the last few years. And even for Dr. Bacchus and I, even for our health insurance, we have seen our own premiums go up as the years progress. For those of you who are on medications, you have seen the cost of those particular drugs almost double in some instances. And for my Medicare patients, they always fall into the hole, which they call the donut hole, which is when the medications are no longer covered and those prices skyrocket. And all this leads back to the cost of the hospital. So whether it be for a routine procedure, getting a joint replacement, or worst case scenario, and I pray this happens to no one, something catastrophic, the cost of your hospital stay may end up being anywhere from 5 to 6 figures.
Yeah. And so all of these points that Dr. Morris mentioned puts that increased demand on physicians and other healthcare providers. And this ultimately leads to decreased time spent with you, the patient. And this leads to suboptimal care and ultimately the dissatisfaction between the patient and the physician.
So what are we proposing? Well, we're proposing a new hope. Now, for my Star Wars fans out there, I'm sure you see the font and you know exactly where this is taken from. But AMG Medical, my wife and I, we are proposing a new hope, a better path forward for your healthcare in this day and age. So what that is, it's a new model of healthcare. It's putting you, the patient, back at the center of the healthcare experience.
And this allows for more of a proactive approach. So we're going to be emphasizing more disease prevention. We're going to be providing more enhanced care coordination, definitely increase physician availability and access at all times. And our ultimate objective is to provide you with that higher level of care, that higher level of service, focusing on your long-term improvement and goals for you to achieve that optimal level of health.
So what is it? It's personalized healthcare. It's membership medicine. So what I'm going to do, I'm going to just read this model, this definition, so that we all know exactly where Dr. B and myself are coming from. So it's a medical model that connects doctors and patients in a highly attentive long-term relationship that promotes health and wellness and provides patients with an individualized, advanced level of care and service, emphasizing the relationship between the patient and us, their physician. So when you think about personalized healthcare, it's centered around three key elements, and I want to make sure that we go through each of these and you understand exactly what it is we're talking about. So let's start off with time. There is no substitute for time. And I'm sure, most of you here who have been to see specialists or other physicians, I've heard the comment from some patients, doc, he came in and his hand never left the door, and he was out in 5 minutes. And that's just based on how physicians and healthcare providers have to practice these days. It's a model where it's a numbers game. It's a churn and burn just to get through. And that's not what we want. If you think back, I like to let you know about Sir William Osler, who is the father of modern medicine. And he had a quote, and what he said was, doctor, if you listen to the patient, you will get the diagnosis. Listening to the patient requires time. Requires being able to spend time and sit down and piece through and put together the puzzle that is the disease or the malady the patient is dealing with. And then we also talk about, this leads to issues of communication. So when you think about communication, every one of you here, who's dealt with a doctor's office have run into the issue of leaving a message. I can't get through the phone system. And now that, with everything going on in the world where we're in a more of a virtual space, you've seen the numbers of phone calls skyrocket because now everything has to be done through this medium. So that leads to frustration. It leads to a degradation of the communication between physician and patient, And let's face it, if you're a physician practicing primary care in the US, your average patient load's about 2,000 to 3,000. It's difficult to be able to get in contact with everyone and be able to be that physician that knows every patient and able to handle all the issues. So for us, we want to eliminate that. We want to give you the ability to cut out the middleman and call us directly. Get that information you need, get that time, call, and be able to get Dr. B or myself instantly.
And all of those, these issues that Dr. Morris just mentioned, it leads to that interrupted relationship that we should be having with our patients. That originally in healthcare model, it was centered around that doctor-patient relationship, and this problem with the reduced time, reduced communication interrupts that relationship. We want to restore that. We want to give you back that value of that genuine doctor-patient relationship, and this is the ultimate value of our model that we are proposing to you today. Mm-hmm. We want you as a patient to have that restored confidence, that restored trust, that your concerns are going to be addressed, that we're going to sit with you, we're going to give you the time, we're going to listen, we're going to address all your concerns and not have you feel like your problems are being dismissed. We want to just, become that doctor that is always there for you, and restore that relationship, as we said, and complete this circle.
All right, so what are the benefits of membership? All right, so we're going to go through each one of these boxes here for a couple minutes each and just kind of explain what we envision for our practice with regards to these particular items here. So let's start off with the expedited office visits and longer appointment times. Expedited visits mean being able to see me same day, see Dr. B same day or next day, not waiting 2 to 3 months to get in to see your primary care physician, which a lot of patients have had issues with, not only, sometimes with us, but with other specialists and other doctors that they see. We have built in an executive style physical, much longer than the regular physical that you would typically get, a lot more in depth, a lot more data is collected by us to be able to build a plan for you that's gonna keep you on the path to wellness. Now, everyone likes swag. So we have developed the AMG Health Swag Bag. Now, what it is, it's actually a tote, reusable, so it's eco-friendly. And in that bag, we have a pulse oximeter, we have a thermometer. We also have a book that Dr. B and I have produced about gut health, which is important. That also leads to later on what Dr. B is going to talk about. And this is something we're put together to kind of give patients the ability to own some part of their healthcare. Okay.
So we want to focus on disease prevention wellness. That's going to be a very important focus for our membership model. We don't want to wait until you start having symptoms of an issue. We want to identify early factors so that we can address it and put a stop to it, and eventually, prevent you from developing something further along the road. And we like to take an integrative approach. I'm going to explain to you what that means. And I'm also going to explain to you a little bit about what functional medicine is, because as we said, as Jody had mentioned in the beginning, we are both internal medicine and functional medicine certified. So integrative approach is basically taking a combination approach of a traditional medicine and natural medicine approach. So we're going to look at you as an individual. This is personalized medicine. We're going to determine what's going to be the best approach for your healthcare, what's going to be the best treatment or prevention for you. Is it going to be a combination of typical pharmaceutical medications, supplements, or either or both? We're going to listen to you. We're going to be that shared decision determining which is going to be the best approach for each of our patients. Now, functional medicine actually addresses more of the root cause of a problem, where we're going to identify causes, things that we can remove from around the environment, et cetera, to help to change the trajectory of that condition or disease. And so it's all in there in the integrative approach, and so that we can have alternative treatment for you. Included in this functional medicine approach is non-traditional hormone therapy, which I'm very passionate about, and I do have a lot of my patients, especially my female patients, on that right now. So you'll be benefiting from all of these in our new model.
Now, how do we do all that? Why do we do that is to optimize patient health, and we also implement using advanced testing to be able to get this done. We are able to do dietary and weight loss counseling at our practice for our clients, obviously for our patients, to be able to get you on that path to weight loss if that's what you're looking for. We have also the ability to do body composition and metabolic testing. Now, what body composition is looking at fat mass, muscle mass, and bone mass, and seeing where you fit on the scale of normal to obese. So that's what that does. And what the metabolic testing does, it kind of gives you a really, really good a measurement of how you burn calories and what we do is we sit down with you and figure out, okay, this is what you tested at. Here's what you need to do to be able to achieve X. And if you're looking to achieve something even more, here's what you could do. So it does help us build that plan for you. And the metabolic testing and body composition are available to our membership clients at no cost.
Yes, and including our advanced testing as well is we're going to be including genetic testing. That's going to be give us a lot of information across the board, from what you should be doing lifestyle-wise, to medications, to what you are at risk for, and how we can further help you prevent. Included in that would be nutrition-based, basically your levels of supplements and vitamins in your body, so we can help to recommend this is what you need to be taking on a daily basis. It's going to be very lifestyle based and preventative. Again, we just want to emphasize that. And we're going to be putting together monthly webinars, whether it be a blog, a webinar, something we're going to push out every month for health and wellness. We're going to be focusing on a different topic each month, and we're going to build on that each month. And we're going to listen to you. We're going to take feedback and, listen to what you want us to put out there. And we're going to be putting together this package. So we're really looking forward to this journey with you.
We also want to be your quarterback. We want to be your advocate. We want to be able to pick up the phone, call your specialist and say, hey, Jim, I have John here. What can we do for him? I'm sure most of you have seen it takes 2 to 3 to 6 months sometimes to get into a specialist. We want to cultivate the relationships where we can pick up the phone, either of us, give a call and say, hey, I need you to see this guy tomorrow. Or they told him in the office that he was going to see you in 3 months. What can you do for me? So leveraging our relationships with the specialists for you guys, our patients, to be able to get you access to care a lot quicker. So that's all part of what we're doing. And I know some of you would like this, especially ladies out there. There is access to VIP pricing for aesthetics at our sister practice, AMG Aesthetics, which is run by the lovely Dr. B here. Now, we also have an in-home visit package, and that is based on need. So it's not something that's widely available. And we have had a few patients tack on. We are limiting the numbers there because we still want to be able to see patients in the office. But for those of you who do require that service, that is available, and you can inquire about that, from Kelly, our liaison. And Dr. B and I, for those of you out there who have your own small business and are looking for, a practice to partner with, to help to keep your workforce on the healthy side, we are building corporate wellness programs as well for those people. So what about insurance? All right, so I want to make clear that your membership fee does not replace health insurance. It does not. We still believe that you have to have some level of healthcare coverage because, let's face it, for things like blood work, imaging studies, referrals to see specialists, medications, even hospital visits, which is a catastrophic care, you still need that health insurance coverage to be able to get some of those things done.
Right. So, and the membership fee is going to cover all of those benefits and access that we just mentioned in the previous slide, the things that are not covered by your insurance. So that is what your membership fee is going to be going towards. So
why invest in your health? All right. So I did a little research. I'm sure everyone knows what Starbucks is, right? A lot of people love it. Dr. B and I, we don't particularly do that much. We kind of make coffee at home. But for those of you who, you got to have your Java, got to have your Starbucks, we kind of look at the cost of things and we kind of put this together. And just, if you're thinking of a cafe latte, a grande cafe latte, and a butter croissant or a muffin, right? The average price of that particular package is around about $6 to $6.50. And that's before tax. And that's per day. So if you're someone, I got to have this every single day, that's what I do the math. That's on a daily basis, $6.50 plus tax, which works out to be over $200 a month. And if you want to think about another thing is from people who smoke. I remember when I was in training, there was a patient who, it was weird. He refused to pay for his 90-day prescription because, his $10 prescription from Walmart, because he said, it's too expensive. I can't do this. And lo and behold, he was a 2-pack-a-day smoker. And this was back in New York. So those of you who are from New York, I'm sure you may know how much cigarettes cost. So, I had a conversation with him. Well, you know what, sir, to be honest, if you just don't buy cigarettes for one day, you could get your medications for 90 days. And the thing is, people don't think in those terms, so it's something I want my patients to begin to see. And the last slide you see here is a picture of TV screens. That's cable TV. Now we've been watching way too much TV with everything going on, everyone being stuck at home. But, we were paying, up until we cut the cord with the cable company earlier this year, upwards of $220 a month before tax. And Dr. B and I, we don't watch that much TV. We watch only a few channels, and I'll tell you what they are: HGTV, Food Network, and our sons, they watch their kids programs. And of course, we do watch the occasional, local news. But that's a lot to pay for something that you hardly ever use.
And that's more expensive than our membership.
Yeah, and there's no return on your investment when you invest in cable TV.
That's true. So this is our annual membership fee. And if you break it down to just a daily cost of it, it's about the cost of the Starbucks that Dr. Morris just spoke about, your medium-sized latte, and most of you don't do mediums, and your butter croissant or your bagel, and that's about $6.50 a day, and that's the cost of it. So it's definitely worth the investment. And we just want to make sure that you know that you can make this payment. You do different options. You have an annual option, a semi-annual, and a quarterly option. So we do have options out there for you to accommodate those who couldn't do the full annual payment up front. And just remember, I just want to let you know that space is limited. And after this webinar, I'm sure we're going to have a lot more sign up. So we want to make sure that you secure your spot, your position today. So make sure you sign up soon, okay?
So I wanted to also show you a side-by-side comparison between our program and whatever else is out there. And one of the big ones that I found online was the Mayo Clinic Medallion program. It's their version of membership medicine. Okay, so this kind of gives you a side-by-side look as to what you get with each of the programs. So let's start off with board certification. So with the Mayo Clinic, you get an internal medicine physician who's board certified. Great. With us, the exact same thing. And the benefit with us is it's actually 2 for the price of 1. You know, you also get both, board certified obesity medicine, and you also get access to our functional and aesthetic medicine as part of the membership. We look at the doctor panel. With them, every physician averages 300 patients. With us, we are keeping our numbers well below that per person each. So we want to make sure that we are available for you to access and get what you need done. When you look at the cost, you already see this is our cost per year. And with the Mayo Clinic Medallion program, it's actually $6,000 for a single and $10,000 for a couple. And with them, it's paid in full. This data I took actually from their website. So you can go and look it up. It's paid in full. With us, we know that sometimes, it's easier to break things up, and with us, we're definitely wanting to work with you to do it either quarterly, biannually, or yearly for those who just want to say, you know what, doc, I just want to get it done, pay it off so I know it's done, which is good. With both programs, 24-hour access. With the services and perks, with them, access to your doctor. And that's great. And to be honest, that mirrors a lot of other membership practices, in that are out there. With us, you get access to us. You get access also to your own health coach, which we will help you secure, obviously. Genetic testing with us. Now we are working with a company actually that will be able to give you genetic testing depending on what you need. So if you're an athlete, high performing person, and you want to get that extra edge, you can do a panel for that. If you're someone who just wants to lose weight, you've done different things and you've hit a roadblock and you can't seem to lose those extra pounds, a lot of times it could be something genetic that we need to address to be able to get you on that path. So okay, you're losing weight again. Another one is the anti-aging panel. That's another one that will be available to you. And if you just want to age more gracefully, it's good to know your genes and what you should and shouldn't be doing in order to achieve that. And of course, we do one for nutritional issues. For those patients who are feeling, I'm always feeling sick. I don't know what it is. It could be my diet. I have GI issues. A lot of times there are chemicals in foods that cause inflammation that lead to illness and maladies. So being able to figure out, so I shouldn't be eating this. That is key to health and wellness. And we do have access, once again, like I said, to the VIP pricing of the AMG Aesthetics, and also the monthly health and wellness webinars with us, where we will educate and teach and make sure that and you're in the know actually of what's new and up and coming in healthcare and ways to keep yourself on the healthy side of medicine.
All right, at this time, I'm going to turn it over to Jody from Cyprus.
Thank you again. So we know, just listening to all of this great information, that many of you are excited, you're ready to sign up, and we want to make this as simple as possible for you. So on this slide, I have listed all of the ways to get in touch with us and actually go ahead and sign up today. So again, we have many members, many patients who have already joined membership, and we do expect to have a wait list. So again, we're just encouraging everyone to please make a decision as quickly as possible. We will need to get payment in order to secure your spot. But as we've mentioned during this presentation, there are a few different options. You can either pay annually or the payment options, which is the quarterly or semi-annual. So on this slide, I have listed our dedicated liaison, which is Kelly Carpenter, her phone number, her email address, and also the best way is to go on to www.yourcyprus.com. And if you are wanting to sign up with Dr. Morris, his name is listed, and then also with Dr. B. So again, Kelly will be able to walk you through all of this. It's a very easy process. And if you have any questions or you need any more information, we do just ask, because we know the phones and email is going to be very busy the next few days after people have a chance to listen in on this recording. So please just be patient with us. We will get back to everybody within a day or 2 days at the very most. So, and just as a reminder, this membership does start effective February 1st. So Definitely, again, we want to encourage everyone to just act as quickly as possible and just secure your spot. So now we are going to go ahead and start the portion of our questions and answers. And as I mentioned at the very beginning, we did receive questions through the chat. We've got several questions, so we're not going to be able to hit on everything tonight. Again, if you have additional questions, we just encourage you to get in contact with Kelly after this call, and she'll be able to go into more details as well. But I do want to read off a few questions that we've received so far and have the doctors answer for us. So the first question was in regards to health savings accounts. Is this something that can be covered, or the membership fee, will that be covered through either my HSA or my FSA?
So my advice to you is to contact your provider, your HSA provider, and tell them what your plans are, tell them what you want to do, and they will direct you accordingly. They'll tell you exactly what you can and can't do with your plan. So it's all up to what is in your contract with your health savings account, your benefit provider.
Great. Okay. And we did have somebody else who also asked the question about insurance. They just want to understand again, how would this work with insurance, and then also my copays.
Okay. So again, as we mentioned, the health insurance is completely different than the membership fee. The services that are covered in the membership fee are the non-covered services that not covered by the insurance. But with respect to the copay, and remember, your health insurance is a contractual agreement between you and your health insurance. And so if it includes a copay for your visit or a particular test, then you are still responsible for that.
Great. The next question is, what happens if I decide that I'm unable to join?
Well, if you've discussed it with your significant other, husband, wife, and say, you know what, we just can't do it. I mean, we are saddened about that, but we do understand that happens. We are working on building a list of physicians that we know that come, in the first quarter of next year, will be opening up to take new patients. So, and that letter should go out in the early January, hopefully, once we can get things ironed out. So that way you're fully aware of what your options are.
Thank you. Next question is, how many patients are you taking in this new practice, and what happens if you reach capacity?
So right now we're planning on maxing out at 400 patients total.
That's 200 each?
Yes. And so when we get to that number, which we're quickly approaching, we will be starting a wait list. So There'll be a wait list, and I am pretty sure that a wait list will be started in the next couple of weeks after this webinar. So you're going to want to act soon.
Yes.
Yes, definitely. What happens if you go on vacation? Who will be covering?
Well, we have actually, there's a few doctors that we have actually identified that will be covering us in the event that we are absent. Now, if we're in the 50 states in the continental US, we'll have our cell phones, so we will be accessible to you. Because the sad part is our phones go everywhere with us. I mean, it sucks for us, but it's a great thing for you guys.
Right. So we want to be available as much as possible, even when we are away. But of course, we will have someone, we will have a covering physician available for, of course, emergency cases, etc.
Yes.
Great. And we actually only have time for one more question. The question is, will you raise your fees?
So the great part of this is for those of you who are signing up right now before we launch in February, you'll be grandfathered in for 3 years for this fee, meaning that your fee is guaranteed for the next 3 years not to increase. But for, in the future, because of increased healthcare costs and increased costs of running the business, et cetera, fees may go up in the future. And we will let patients know if that ever is going to happen, and, for new members, explain why, et cetera. But again, for those of you that are signing up right now, for 3 years, you guarantee that your fee will not increase. So With that last question, we just want to thank you for being part of our webinar tonight. We've really enjoyed explaining all of this to you and explaining our new model. And if you have any further questions, I will put Kelly's information back up on the screen, and you feel free to call her. And if she can't answer your questions, we will. So
thank you so much, guys, for giving us your time tonight. So once again, so think about it. We do want people to make the conscious decision. We do realize it's not for everyone. And what Dr. B and I are looking for are partners in healthcare. We want patients who are engaged, who want to get better, who are open to new treatment modalities to be able to achieve wellness and optimal health. So thank you again. Be safe. And we look forward to having you as part of practice.
we'll see you soon. Have a good night, guys.